Good afternoon, everybody. My name is Billiejoan Rice, and I am a lecturer in the School of Nursing Midwifery at Queen's University, Belfast. And I want to present to you this afternoon a study that I conducted as part of my taught doctorate in education. And basically, it was entitled Teaching and Learning Professionalism Using Simulation in an IPE context. So what I wanted to do was, the aim of the study was to explore if the use of patient scenarios and simulation was a useful approach to teach and learn professionalism in an IPE context with undergraduate medical and nursing students. I'm quite entrenched in IPE education in the university, and I am involved with teaching fourth-year medical students and third-year nursing students as well. So that was the aim of my study, and the background to it was, and I think we're all very acutely aware of the amount of emphasis that has been placed on professionalism, both within medicine and within nursing, and it has really come under immense scrutiny over the past few years, and so many debates centre around how to define professionalism, how to promote it, and what actually are the best approaches to employ to teach professionalism, both in the medical and the nursing curricula. So really, for me, the catalyst for conducting this study was really the findings from reports such as Francis, Keogh, Berwick, and it was really whereby feelings of professionalism and professional behaviour amongst clinicians were identified. And really, in the wake of the findings from Staffordshire, the key focus for patient safety, policy and practice was responding to 290 recommendations that made by the Francis Inquiry. And one of these recommendations was increased education and professional development on delivering compassionate care and a re-emphasis on common values throughout the system. And really, presently, this requires both nurses and members of the multidisciplinary team to revise and to reflect on key professional values and their professional responsibility to patients. Professional values must underpin education and practice, and remaining cognizant of this, and combined with the findings from the Francis Inquiry and from my experience of teaching interprofessionally, I had ongoing collaborative discussions with my medical colleagues, and we were talking about where is professionalism taught in the medical curricula and in the nursing curricula, and how is it taught. And what we discovered was it is actually taught, but it's taught like this in a big lecture theatre. It's maybe an hour's lecture on good medical practice for the School of Medicine, and maybe the code for nursing. And so really it was there, but it was quite implicit. And we thought, this needs to be brought forward. It needs to be much, much more explicit. And so the idea for the methodology of the study came through realising this, and then researching, looking at the literature to see what was out there in relation to teaching professionalism. What I found was that there was a dearth of information and studies done on teaching professionalism using simulation in an IPE context. So that was really the main motivation for actually doing the study. So what I did was, I designed an interpretive qualitative approach, and it was based on a framework called symbolic interactionism. And this framework guided my study. And what this does is it allows researchers to examine the social context of interaction. So it helps researchers to understand how individuals create and attach meaning to a particular phenomenon, and to understand how this meaning influences their behaviour and their action. So that was the framework that I used, and I collected my data and I divided it up into two phases. So what I did was, obviously I was using simulation, and so phase one of my data collection was video analysis and field notes. So I'd taken field notes during the actual simulation, and obviously I analysed the videos of the simulation, and also the post-scenario debrief I used that as part of my phase 1. And phase 2, I conducted focus group interviews with the students afterwards to find out what they actually thought of this method to teach professionalism. So the setting, it was conducted within the school, and this is just a view of our simulation suite, and that's at Queen's University in Belfast. What we have is a very compact compact room. It's really a purpose-built ward area, and it consists of a side ward and a debrief room, and again it's separated by the one-way mirror, which you can see there. That's what we're using at the moment, but we're at a very exciting time in Queen's. We're actually developing a brand new simulation suite, and again, it is going to be faculty-wide, so with a big emphasis on interprofessional education. So until that is opened, this is our simulation suite that we're using at the moment, and this is just another view of the room. So as you can see, it really is quite compact, and so everything is there in the room to actually manage the scenarios that we're actually running. So my sample, so what I used was a purposive sample. And in total, I had 14 students. It was a qualitative study. And of the 14 students, I had 6 medical students and 8 nursing students. The medical students were 4th years and the nursing students were 3rd years. And these students were chosen, particularly, they're a little bit more senior, and that was because I chose them deliberately because they had advanced in the theoretical and the clinical components of their respective courses. And I felt that they would have encountered issues concerning professionalism, both in university and in practice. So I spoke to the students in lectures, sent emails, I had employed a gatekeeper, I also had posters up. So in total, my sample size was 14, and I obviously had received ethical approval from the university. So my 2 scenarios, I ran 2 scenarios, and basically the scenarios were developed by the Royal College of Medicine, and they're licensed for use, were by practitioners or educationalists. They're free to use these scenarios or perform derivative works. So my first scenario was a 16-year-old girl was brought into A&E accompanied by her father after taking a tricyclic acid overdose. And my second scenario involved a 75-year-old gentleman who was admitted into a medical ward with a urinary tract infection. He had suffered from dementia, but he was given an extra dose of paracetamol in error. So really what I was trying to do was both scenarios addressed elements of professionalism as outlined both in the NMC code and also in good medical practice, and also the joint statement by the NMC and the GMC on the duty of candour. So what I did was I developed a matrix of the codes, and then I actually mapped the scenarios to each of the standards within the codes. So my analysis was field notes, video analysis, post-scenario debrief, and the focus group interview. So really I generated quite a lot of data from all of that, and what I needed then, I had developed an inductive approach to the actual video analysis, and again I used a framework that is established to help analyze videos by two researchers called Derry et al. And Erickson. Because I had generated a lot of data, I also used in vivo just to help literally manage the actual files. All transcripts were reviewed, data coded, and again categorized into themes. So the method of focus group data analysis was content analysis. So thematic analysis captured much of the data, and again, it provided overarching themes. And what I did at the end of all that data was I triangulated it all to obtain a more complex understanding of what I had obtained. So what I got was the key themes that were derived from the video analysis, the field notes, and the post-scenario debrief were communication, teamwork, patient safety, and honesty. So they were the 4 key themes that all of my data revealed. So the communication focused very much on verbal communication and on non-verbal communication. So that was obviously looking at explanation skills, reassurance, body language, empathy, their listening skills, touch. But key aspects of communication which the students learned was the importance of language used to convey information, their choice of words whenever they were speaking to the patient, speaking to the relative, and indeed speaking to each other in the team. How to break bad news. Very often again, the words that were chosen to break bad news were very, very important, because if the student struggled, the patient became confused, the relative became very upset. And this again was creating, does this nurse, does this doctor understand what they're doing? And again, an unprofessional opinion was actually developing because of the way that bad news was actually being broken. The other theme, which was teamwork. So coming together, working collaboratively, understanding each other's roles was another theme. Mutual understanding, leadership, appropriate delegation. These were all really, really important elements of teamwork. If teamwork was deficient, then the patient outcomes were affected, as we all know, and obviously the incidence of adverse effects will increase. Patient safety encompassed their clinical skills, their knowledge, their situational awareness, and their ability to recognise when to call for senior help and appropriate and timely escalation. And honesty. Well, honesty speaks for itself. And what was very reassuring about my findings was in the second scenario, whereby the students were required to disclose an error to the patient, in that an extra dose of paracetamol was given in error, every single student actually did that. And they said it was very reassuring for us as facilitators to see the nurse and the doctor, when they identified the error, the first thing they said was, we need to tell the patient, we need to tell the family. So that was really good, and it highlighted for us that their sense of their duty of candour was very high. So again, is this because of their own strong moral values, or is it because it's taught very well? So that was one of the strong things that stood out in the study as well. The findings from the focus groups. So one of the key questions that the focus groups asked were, what elements of professionalism have you learned from participating in this? And they said communication and teamwork were very strong for us. And I lifted some of their quotes. And one of the students said, this is an excellent way of training you to be able to practice and communicate professionally. And again, just reinforcing what I'd said, I learned the importance of choosing words carefully when communicating with the patient and the family in a way that they will understand. This is an important element of professionalism. Teamwork also stood out, and the students said, I need to learn that it is just not me in my silo. There is a team, and I need to involve the team. That is learning professionalism. And another student said, we are the backbone of the team when we qualify, and we need to grow in confidence working together, which will ultimately make the team more professional. As a method, again, the students really, and as so many of us actually encounter in our practice with simulation, the feedback is always really positive. But again, in this study, it was overwhelmingly positive. And the students said, this helps us to put everything together. Your clinical skills, dealing with the situation medically, the situation in the room, the relatives, and thinking about yourself as a professional. This brings it all together. And the key thing that they said was it was the IPE element. It was the nurse and the doctor working together that was pivotal in helping them to consolidate their sense of professionalism, but also how to work effectively as a team. And this was actually my favourite quote from the entire study. This was a nursing student, and she was very passionate on it whenever she said this. And she said, it is one thing learning professionalism from a lecture or a tutorial, but you need to live it. How are you expected to learn and anticipate things? And she'd said as well, and become a professional. How would you cope if you hadn't already experienced it? Patient scenarios and simulation is definitely a good method to learn about professionalism. And again, a lot of the students did reinforce the shared learning and the IPE. So basically then, the summary. So what I found was communication was central in this study, and awareness of the importance of effective communication as a central component of professionalism really stood out. And how, if communication failed, this impacted on teamwork, it impacted on patient safety, obviously, and honesty as well. And all participants stressed the importance of the IPE element. So it's a useful, valuable approach to teaching and learning professionalism, simulation, and IPE context, as again they'd said. So the future, where do we go with this? So teaching and learning professionalism in an IPE context using simulation, we felt it should be introduced at the beginning of the student's undergraduate training. And when we say that, there is a public expectation that nurses and doctors are trained together. And I know certainly within my own friends who are non-medical, were really shocked when I had said, no, we don't bring them together till later on in their training. They had thought that they're brought together much earlier. So I thought, from talking with the students, they had said, we should be coming together from year one. So in a way, I felt a way to do that is maybe take the year one students and get them to observe the senior students doing or participating in simulation. And so they're getting a sense of what simulation is, but also learning the importance of professionalism from watching their senior peers. And what we could do then is increase it, augment it in second year. So in second year, use less complex scenarios, and then third year, use even further ones. So that was my study. Thank you very much for your attention.